Hello and welcome to Personal Injury Today. My name is Brandi McMichael with Dr. Brad Poppie, and today's subject is a medical diagnosis is only as good as a functional assessment that backs it up. Dr. Poppie, my first question is, in a personal injury, why is solely a medical diagnosis not adequate to stand up in trial?
When you talk about diagnoses, the medical diagnosis is going to be based on two separate entities. So the first is going to be their objective evaluation, where they take the client through range of motion testing, strength testing, basically an orthopedic exam on the desired body part to determine impairments, as well as they will cross-reference those findings objective-wise with diagnostic imaging studies, CT scans, MRIs, X-rays, etc. And they'll kind of, segue those in together to determine a diagnosis.
Okay.
Well, years ago, 20 years ago, when a client had positive disc findings on an MRI, for example, they had a disc bulge or a disc herniation, or maybe a ligamentous tear, a sprain of a ligament, or maybe even some broken bones. 20 years ago, those could be potentially case driving policy limit indicators. Today it's not, okay? Because you've probably had broken bones in your life, and you're fine, per se, otherwise fine. Jury members in trial, a lot of them have had car accidents and had some, bumps and impairments, abrasion on their skin and broken bones and maybe some disc herniations, and they're otherwise fine. So by banking on just a medical diagnosis to be your ace in the hole at trial is a horrible case management strategy, because the insurance company knows that just a medical diagnosis is not enough artillery to really paint the picture on why that person needs X settlement or deserves X settlement for what they're asking for.
Okay. If you guys are liking these videos and find them to be educational and informative and beneficial, like, subscribe, hit that bell, and be notified of future videos. My next question and last question is, what functional assessment confirms the diagnosis?
So that is done via a very exhaustive evaluation called the functional capacity evaluation. And I've talked about this many times in my previous videos. It's a very underutilized evaluation because a lot of people don't equate the functional capacity evaluation to personal injury. It's been very well documented and utilized in the workers' comp sector, but injury is injury.
Right.
And so personal injury attorneys are now understanding that this test, the FCE functional capacity evaluation, is the standard of care or standard of evaluative care in determining impairments and disability. Okay, so previously, again, 10 years ago, 20 years ago, a lot of times attorneys relied on impairment ratings. So an impairment rating is done by a workers' comp physician, okay, that has gone through the training to determine an impairment rating on an individual. Well, what that equates to is they will do an exam and they go through the impairment guide and determine, okay, based on broken bones and disc herniations and whatever this person has, that equates to a 10% whole body disability rating or 20% or whatever the percent is. Whoopee, what does that say? I don't know. It's a number, okay? Because impairment ratings do not take into consideration disability. So when that patient goes to their employer and says, well, my physician said I have a 15% impairment rating. Whoopee.
Yeah.
What does that mean to me? Nothing. So attorneys, if you're going to do an impairment rating, make sure you have a functional capacity evaluation to determine the disability
Yeah.
along with that impairment rating. Now you've got something. You've got something that will stand up in trial and make sure that and help educate the jury members on really what the true disability factor is that's allowed or that disallows them from a quality of life.
Right. Wow, that's so good. Thank you so much, Dr. Poppy, for that amazing and useful information. And we will see you next time on Personal Injury Today.